On healthcare, when you talk about, wanting to protect Americans' healthcare, drawing a red line, letting Republicans know that no partisan spending bill without healthcare protection it won't be supported by Democrats. Is that something that your members? It just seems as though there's members want different things from this particular negotiation. How are you as leader navigating all of the different, some folks want anti-impoundment language and no more rescission. Some folks say healthcare is enough. Some folks say a clean CR that just keeps the government open is enough. How are you, given what happened in March, given, the Senate considerations, kind of from your perspective as we stand on September 10th, how are you thinking about your conversations, not just with Republicans on the other side of the aisle, but Democrats in your own caucus and Schumer? Just give us some insight into how you're approaching it.
We look forward to our conversation with Leader Schumer and Democratic leaders in the Senate later on this afternoon as we enter into a more intense phase around the spending showdown in advance of the end of the fiscal year. Democrats broadly agree on two things. One, Republicans have launched an extraordinary and unprecedented attack on the health care of the American people. Extraordinary and unprecedented attack. Ending Medicaid as we know it. Setting in motion the closure of hospitals, nursing homes, and community-based clinics all across the country, including disproportionately in rural America. More than 20 million Americans are likely to confront skyrocketing healthcare premiums, copays, and deductibles because of the Republican refusal to extend the tax subsidies for the Affordable Care Act. As a result of the Republican one big ugly bill, Medicare is facing a $536 billion cut at the end of this year. And on top of all of that, Republicans are now trying to jam down the throats of the American people an appropriations bill that was just voted out of the Labor H subcommittee and then the Appropriations Committee that represents an all-out attack on public health, on medical research, on vaccines, and on the Centers for Disease Control. An all-out attack on health care is what we are in the midst of right now. Every single Democrat stands against that and believes it is important at this moment because of the extraordinary attack on health care and the fact that it is a cost of living issue. Housing and health care being the two most expensive parts of day-to-day life for everyday Americans, that we cannot, under any circumstances, support a partisan Republican bill that continues to rip health care away from the American people. I believe that's a consensus position that brings together progressives, New Dems, Blue Dogs, Battleground members, and all points in between. Thanks. Yep.
Thanks, Mr. Leader. Just to piggyback off of Michael's question there, I just wanted to ask you too. I think it's very true that many of your Democratic members agree on that healthcare position. I would argue Senate Democrats do as well. However, there's still a lot of members within your caucus who just want to use this moment of funding as a fight. They really just want to see more energy there. And I know Republicans over on the House side may not need Democratic votes here. There's a lot of mistrust, it seems, with a lot of House Democrats, with Senate Democrats. They want to see the Senate react in a way that's very different from March. I know you have that meeting, you mentioned it today. But how are you trying to assuage even those concerns, that eagerness from a lot of members?
Well, we look forward to our meeting later on this afternoon, which is part of a continuing series of meetings that we've held with Leader Schumer and Senate Democrats over the last several months. And I expect that coming out of the meeting, you'll continue to see a strong and unified position. Every single Democrat in the House and the Senate voted against the Republican One Big Ugly Bill. Why? Because the One Big Ugly Bill hurt everyday Americans in order to reward their billionaire donors. The One Big Ugly Bill ripped away health care from millions of Americans, stole food from the mouths of hungry children, seniors, and veterans, and all of it was done to reward their billionaire donors with massive tax breaks. It's the reason why the One Big Ugly Bill is so deeply unpopular, and Donald Trump, who supposedly is the king of branding, has walked away from his own branding. Every single Democrat in the House and the Senate voted against that One Big Ugly Bill, and we will continue to speak out against it. And Republicans are now hiding under a rock. They're in the witness protection program as it relates to their signature piece of legislation. And so I believe that all of us are ready to continue the fight. And healthcare being right at the top of that list. But the fight, of course, is about all of the things, all of the extremism, the parade of horribles that Donald Trump has unleashed on the American people and their failed promises to make life more affordable.